I think it's the hardest challenge is exactly what you just pointed out. It's they're in this gap, and they're trying so hard to be young adults. They're in a transition phase in their life. They're often relatively independent or trying very hard to be. And so you need a really good support system to go through the arduous and long treatments for ALL. And so what we've done in our center has been to establish a joint clinic with my pediatric colleagues to treat the young adults with acute lymphoblastic leukemia and acute myeloid leukemia. And the reason I think for this clinic, or the main benefit of this clinic, is we hope to have more of a one-stop shop, so to speak. So we have a psychologist, we have social work, we have physical therapy all together in the clinic, so that the patients don't have to make too many trips back and forth, because they're already coming very frequently for treatment. ALL treatment is frequent, it's outpatient, and it's long. So to be able to create a community and sort of a support network for these patients and allow them to comply with the treatment is crucial. And I think that one of the things we never talk about, or rarely talk about in our talks when we are presenting these data, and we were just chatting about it a bit this morning in our little session, was how compliant are people with finishing these regimens when they're adults. And sadly, it's not very much. And so I think efforts to sort of consolidate and support young adults, I think it's true for older adults too, but especially this population where they're very much alone in their lives and trying to establish themselves as independent adults, it's going to be very, very important. And we've had this clinic now for about 7 years. And it's been one of the most gratifying experiences of my career, because I enjoy working with my pediatric colleagues. We collaborate on ideas, we collaborate on some clinical trials and some supportive care trials, and also for our patients who really, I think, have benefited. And I note for sure, and I don't have the exact data to support it yet, but an increased rate of compliance for sure. It's much easier to get them through this when you have that sort of community to support them.